Welcome. We're now to segment 6 for the allergy-free training series. We're going to go over the feasibility study and the revenue analysis for clinics and how allergy-free can generate not only increasing the value of the program for the clinic itself, but also generating a lot of additional income to the bottom line for the clinic on a very low volume with a very simple way to do it. So here is the the doctor-provider feasibility survey. On the right, you'll see the cover of the trifold. This is something that we usually bring in, and we train sales reps on how to present this to doctors in the practice. So we look at family practice, general practice, functional medicine, urgent care, osteopathic, OBGYN, pediatrics, as well as dermatology, sleep clinics, and also gastroenterology. So when we present these types of things, we want to be able to target doctors that maybe are referring allergy patients out to somebody else. And if you take a look at the middle piece there, where it says sign up today and see what you've been missing, low start costs for $5,750, you can start with a 25 patient kit that includes full day training on site. That includes all of your marketing material. That includes cross-training all of your staff for an entire day, live patient training for an entire day, and so that's on the convenient training piece. The easy billing portion, there's basically one CPT code. It's 95004, and you do that times 70, and we'll go over the revenue analysis here in a little bit. Based on what your typical family practice would look like. It is honestly the simplest allergy program you could possibly do in the office because it does not require shots. So it is completely needle-free, and there are no long-term contracts. You make your money off of that first kit. You see how fast you go through that first kit. You see how simple it is with that first kit. If you decide you don't want to do it after that, fine, you're done. You don't have to do any, there's no contracts whatsoever. We do not come in and take over your practice. We do not take over a room. We supply the products. We teach your staff. Your staff ends up doing everything, and we follow the golden rule. He who does the test gets paid. So you do the reimbursement, you do the billing, you do the testing, you do the sublingual immunotherapy, and we supply everything. So we teach you how to fish, you go fish. We supply you with the line, the hooks, the nets. We supply everything to you, but you're doing the fishing. So you're doing the testing, you're taking care of the patient. Low risk, high reward. That's what we, with this particular program, there is literally no risk for you ever having to worry about any kind of a anaphylactic reaction here, because these are simple inhalant allergies is what we're targeting. We're not targeting anything complicated or complex or high risk like a peanut allergy or a Hymenoptera allergy. What I mean by that is either a wasp or a bee allergy. We don't deal with any of the food allergies here. It's simply the inhalant ones. It's the basic ones. And if there's anything above and beyond that, when we've already gone through a bunch of this stuff on the key concepts as far as the cross-reactivity to food, we've already covered all that stuff. So we go through all the training on this. Now, on the portion right here above me, this is where I will come in, or one of the sales reps will come in and say, how many times do you see patients dealing with these on a daily basis? Of course, you'll sit there and look at it and say, all right, I get it. Rhinitis, fatigue. When somebody has fatigue, you don't feel well. And when you don't feel well, you go into the doctor's offices. And a lot of times it can be triggered by allergy or it could be a cold. You don't know until you do the testing, which is the whole reason why you do the testing. We discussed that in a previous segment as well. Post-nasal drip, abdominal pain. If there's a GI issue, it's usually abdominal pain. Abdominal pain can be related to irritable bowel syndrome, celiac disease, which is an allergy. It's having to deal with gluten. So we can identify that. Dermatological, we're looking at atopic dermatitis. One of the most common reasons why people go into the dermatologist all the time is I've got a rash, I've got eczema, I've got hives. Those are allergic reactions. Those are external reactions or external symptoms to an internal allergy. Asthma. bronchitis, cough, upper respiratory, sinusitis, laryngitis, wheezing, you name it. Those are typical things that doctors are going to see in their practice every single day. Now, flip that sheet over, and here's the other side of that trifold. On the feasibility study, we come in and we basically take their business card and the contact person, whether it be the doctor, the office manager, nurse practitioner, whatever. We get their information down, and then you see the clinic volume survey and the feasibility survey. Let's blow that up a little bit so we can show you what that means. How many patients a day do you see in a normal business day? A one doctor practice that's not very busy will see about 30 patients a day. That's pretty low volume. Now, based on studies and on research statistics, we know that statistically, 1 out of every 5 allergy patients walks through a primary care door. So if we look at 30 divided by 5, that gives us a total of 6. Well, that's going to be a high volume. That's basically what the statistics say. Cut that in half, that's 3, which is only 10%. Cut that in half again, hell, we can even put it at a low volume of 1, and I'll show you that here in a second. But then we take a look at how many days are you open. Are you open 5 days a week, like most family practice? Or is this an urgent care or an extended pediatric clinic? You're looking at 7 days a week. So we take that volume of 20%, we put in 6, cut that in half, 10%, and then we lower that down to even 1. So how do you normally treat those patients? Well, we'll offer Claritin, a steroid shot. We might refer off to an allergist because most primary care thinks that this is beyond their scope when it's not. This is a very, very simple project to be able to do in your office. So we take that one CPT code of 95004, which on the average, national average of a Medicare reimbursement is $5.31. We multiply that times 70 units because there's 70 tests on the screen test. So that's $371. And we take off that $160 cost. That brings us down to $211.70. Take that $211.70, multiply it by 1 patient a day times 20 working days, and now you've got $4,234 a month. You take that $4,234 and multiply it by 12, you are netting. Keep in mind, we took the $160 out already. So we already took the cost per test out. So your net income for only 1 patient a day is $50,000 a year. Net income. You didn't have to pay anybody other than your staff. You're paying your staff anyway. So all you're doing is adding an ancillary service that's bringing in an additional $50,000 on 1 patient a day, and you are no longer losing control of that patient. You're not referring them out to an allergist for basic allergy care. So does this make sense to a clinic? On 1 a day at $50,000 in profit a year based on national Medicare reimbursement, knowing that knowing that private pay insurance is going to pay higher than that. So it could be up into the $7 range per test. And we just don't know until you look at what your contracts are. But we can always utilize the national average reimbursement of $5.31, and we use that. So does it make sense? Absolutely. So let's take a look at what it would be just at 3, as far as 10% of your practice would be testing. You take that same $211, you multiply it times 3 times 20 working days. So you're looking at $600, somewhere around there, so per day. So you take that 3 patients times 20 working days, and you multiply that out to $12,702 a month. Take that $12,000 and multiply it by 12 months, and what do you get? $152,000 a year in net income on just one thing, doing just one allergy, being able to bring the value back to the practice and not farming out a patient. I got to tell you, patients tell me all the time, they do not like going to a primary care and they're being farmed out to somewhere else. They do not like it. They come to you because they trust you. They come to you because they like your clinic. They come to you because they come to you for everything, so they don't want to be farmed out. Does this make sense at $152,000 a year times 3 patients a day? Hell yeah, it does. Why wouldn't it? So now let's take a look. That's just the testing portion. So now let's take a look at the therapy. In the allergy world, therapy can charge anywhere between $4,500 to $6,000 a year for allergy shots. Now, why don't they do sublingual immunotherapy? Because it's cheaper, safer, long-lasting? It's because sublingual immunotherapy is not reimbursable. So that's why they don't do it. Even though Europe has been doing it for decades, they have stopped doing allergy shots because the risk versus benefit is not worth it. They don't want to do it. And they are universal healthcare. They are not pay per service healthcare. So here, doctors are paid with us, with our program, doctors are paid patient management and compliance fee for $20 per dropper from Firehorse Health and Wellness. That's our company. We're the ones that developed AllergyFree. This revenue does not include any potential office visits, like nurse visits for the recall or for following up with the patient and managing that patient. That's optional. Our assumption here is that we do one patient every other day that starts the drops. That means it's only 10 patients a day. So at 10 patients a day, 10 patients a month, what that allows us to do is say, let's say you're doing 2 patients a day, or even saying 1 patient a day. And what we're saying is that, let's say you're 50% close rate on those drops, which is super low compared to what we normally see. Is usually about an 80% close rate on people that do the test and then continue with the therapy. So even if you're doing 1 a day and we're doing only 1 dropper every other day, that is 10 droppers a month on a prescription. Now, because this is a cash pay prescription, we can pay a patient management and compliance fee from the marketing and development company, which is us, even though our pharmacy, we pay the pharmacy. So the pharmacy then gets paid through Firehorse. And so we ship it directly either to the patient's front door or to the doctor office. And we'll go over that here in a second. So let's say, for example, you've got a consistent volume of flowing, setting up patients at 10 patients a month on the droppers. And you can do that consistently every month, right? So you get 10 new patients every month, and then you get 10 returning patients. Then on month 3, you get 10 brand new patients in dropper 1, 10 patients returning for dropper 2, 10 patients returning for dropper 3, 10 patients returning for dropper 4. You see how this goes. So then you get down to the maintenance where you've got droppers coming in. And at this point, we ship the dropper number 5 directly to the patient's front door. They don't have to keep coming back into the office. So don't think that as your patient volume grows, you're going to have all of these patients coming back for drops. That's not the case. You're only doing it month 1 through 5, just to get them, make sure that they're compliant, make sure they're following everything, make sure that everything's okay, they haven't had any issues, and everything's cool. So at this point, now you're going to start seeing the dropper maintenance number 5 start to multiply. And you're still bringing in 10 new patients, 10 new patients, 10 new patients every single month, right? And so assuming that all the patients stay on the drops for all 12 months, you are looking at the end of the year, one clinic doing 1 dropper every other day is 780 droppers times $20 is $15,600 in profit coming back to the clinic just for monitoring the patients and making sure they stay on the drops. That's it. $20 a dropper. And we pay every single month back to the clinic with the dropper. So pretty simple. Very, very easy. Super inexpensive compared to, just think about it. $160 a month is just, and you multiply that times 12 months, you're looking at $1,920 over a 30-day period, 30 days, 30 days, 30 days. That's still significantly cheaper than the $4,600 all the way up to the $6,000 for doing allergy shots. And allergy shots are not as effective. They're not as safe. They take a weekly shot, so they're coming back once a week for the next 3 to 6 years. That's why compliance on these things are so low, because on allergy shots, you're looking at 20 to 25% compliance. When you're looking at allergy drops, the out-of-pocket cost is there, but it's significantly less than it would be for a copay, driving to the clinic, sitting in the office for an hour once a week, and waiting to see if you have an anaphylactic reaction and die in the office. No, that's not interesting to anybody. So the sublingual immunotherapy is the safest, most comprehensive, and most fast-acting immunotherapy that's available. So when you take a look at what it would be if there were 2 droppers a day or only 1 dropper a day, so you just now doubled it. So let's say you are doing 1 patient a day or 2 patients a day on the testing, and you're still doing only the 50% close rate on the dropper, but now it's 20 droppers a month. You just made an extra $30,000 on top of $150,000 that you made on the patients already. So this is a significant revenue stream for the clinic, but more importantly, you are taking care of the patient with a safer, less expensive, more convenient option. And when it's more convenient, it's more compliant. When it's more compliant, you get a better result. And that's what the whole point is. So now let's talk about where we are with how to manage the allergy patient. Now, this is where we kind of come in and we walk through the patient flow. So allergy patient volume will dictate how you manage that patient flow. So for example, let's say you've got a low volume and you're only doing 1 patient every other day. So let's say it's Monday, Wednesday, and Friday. You only have 3 patients. That's it. 3 patients a week is 3, 6, 9, 12 patients a month. That's it, right? 12 patients a month. If you just did 12 patients a month, that would be 1 day in the clinic. You just have 1 day designated for 1 room with 1 MA, and you book all your allergy patients on that 1 day in that 1 room, and you can handle 6 patients in the morning and 6 patients at night. You handle that 12 patients, and you do 1 day. 1 day in the clinic will generate $211 times 12 patients for that day will generate $2,540 for that day. You multiply that times 12 months. Just assuming you don't increase your volume and it's always at 1 every other day, you're still looking at $30,000 in profit at the end of the month based on normal average Medicare reimbursement for 95004. So now let's take a look at medium volume. If you just did 2 patients a day, 2, that's it. 2 patients a day is based on 30 patients is less than 10%. So if you did 2 patients a day consistently all the time, you would be looking at 1 room doing 1 room each week. So now you're looking at 10 patients a week. So you do 5 in the morning, 5 in the evening, or 5 in the afternoon. Now you're doing only 1 day. Let's say Wednesday is your allergy day in your practice. So now you've got consistently Wednesday. Every single Wednesday in that 1 room is going to be 1 MA, 1 room, allergy. That's it. So for that 1 day in that 1 room, you're going to be able to do 40 patients in that month, which will generate about $8,444. And you're looking at times 12 months, which is $100,000 a year in net income. And you're not doing that right now. So why not? Because you didn't have the capability, you didn't have the knowledge, you thought it was out of your scope. You thought, oh, well, we'll just refer this. Well, at $100,000 on 2 patients a day, you're going to refer that out? No. If your allergist is only giving you a Christmas card during Christmas for thank you for the referrals, he should be sending you a Christmas card, a Christmas car instead of a Christmas card. Okay? At $100,000 a year, he should be giving you a heck of a lot more than a business card saying thank you. All right. Now, let's do a higher volume. If you're looking at 4 patients a day, you're looking at 20 patients a week or 80 patients a month. That's huffing it now. Now you've got 2 days a week that you're really starting to crank out. That's 80 patients a month. That's designated 2 rooms and 1 MA, so you can shuffle it back and forth, or 2 rooms, 2 MAs, because we're cross-training everybody, right? So you get that 1 person or the 2 people that really like to do the allergy training and they just absorb it, they really like it. Or when we come in and we do the training and we have those patients that are, either they are allergic and we test them on that training day. So we test the staff and we test the friends and family. And they're watching on the drops their child that has asthma that is now no longer has asthma, or their husband that constantly has sinus infections no longer has sinus infections. They will be the first ones to say, I want to do this. Let me be the person, because I know what it's like to be with allergies and then not be with allergies. Let me run with it. And so, great, let them run with it. But if you take a look at 4 a day, that is $200,000 a year in net income. Did you catch that? $200,000 a year. So again, why aren't you doing this? It's because you didn't know that this was available. Now it's available. So now you can go ahead and sign up. Let's get this thing done. If you guys are tired of working your tail off and working harder and not smarter, that's not smart. So we're giving you an option right now to get at a very low end entry point of $5,700. You make that up in the first month. In the first kit, you've already made that up. You have no contracts required. You have no obligation after that first kit. And if you really find that your clinic just takes off with this thing, you can literally create just one room that will generate allergy for yourself. We don't come in, we don't take over your clinic. We don't take over the practice. We show you how to fish, and you go fish. Super easy. We supply everything. That's all we do. We supply the training, we supply the education, we supply the forms, we supply everything else and your marketing material. We supply all of that. We just don't do it. We teach you how to do it. And he who does the testing gets paid. That's the golden rule, right? So do the test, get the therapy, get your patients feeling better, expand your practice, because this value of this particular ancillary program in your practice can be extremely significant. So I wish you well. And if you have any other questions, feel free to contact us at allergyfree.care. And thank you very much. We look forward to hearing from you and look forward to working with you in your practice.